right, good morning, and thank you to our media for being here today to discuss school closures across Yellowknife and some of the recent public health advisories that have been distributed. With us today, we have Premier Cochrane, Minister Green, Minister of Health and Social Services, Dr. Kandola, Chief Public Health Officer, and Dr. Pegg, our Territorial Medical Director. Minister Simpson, Minister of Education, Culture and Employment, also wanted to be here, but following CPHO recommendations to limit travel in and out of Yellowknife, he is not here today. He will, however, be available for questions later from media if you have any, so you guys can touch base with me afterwards or email Press Secretary and we'll arrange those. One important thing to note before we begin today, of course, Minister Simpson, as he would speak to it, he would let you know that ECE and the Office of the Chief Public Health Officer have been working very closely together throughout this process, and so he can speak to that in detail later, or Dr. Kandola will likely mention it in her statement a little later on. So we know there are a ton of questions, and we'll get started right away. I'll invite Premier Cochrane to deliver some opening remarks.
Okay. Thank you. Good morning, everyone. Thank you for being here today. With me today, I have Health and Social Services Minister Julie Green, Chief Public Health Officer, Dr. Kandola, and Territorial Medical Director, Dr. Anne-Marie Pegg. The last few days have been what we've been preparing for as a territory since the beginning of this pandemic, as we have watched the third wave of COVID-19 challenge our neighbours to the south and, sadly, in recent weeks, our northern neighbours in the Yukon and Nunavut. It was inevitable that we would see our own cases rise. The situation in Yellowknife is fluid, and we don't have all the answers yet. When we have new information to share, we are committed to keeping residents informed. Our healthcare professionals at the Office of the Chief Public Health Officer and the Northwest Territories Health and Social Services Authority, as well as staff in the COVID-19 Coordinating Secretariat, have been working day and night to contain the virus. Since the beginning of the pandemic, safety and preparedness have been our top priorities and continues to be today as we deal with our second outbreak in a community. We've spent the last 14 months understanding the best practices for dealing with an outbreak. We have strong processes in place for managing this situation. The decision of the Chief Public Health Officer to close all schools in Yellowknife was out of an abundance of caution. It was a decision meant to ensure that the spread was contained and to not take any unnecessary risks that further jeopardize the health of residents. COVID-19 is spread by extended contact with infectious individuals, and public health is following up with known contacts of the people who have tested positive. If public health has not actively reached out to you, you have not been identified as a contact of a case of COVID-19. Where the Office of the Chief Public Health Officer is not able to identify all contacts, it is providing public exposure notifications so people can identify themselves as possibly being exposed. This list will be updated if further exposures are identified. Please be aware that if public health has not been in contact to ask that you be tested and you do not have any symptoms, there is no reason to be tested at this time. If you've been contacted by public health or have symptoms, please get tested. It's important that we allow public health to do their jobs and focus on all areas of concern at this time. There's going to be a lot of speculation and rumors over the next few days. It's important that you get your information from reputable sources. Rumors and incorrect information only make it more difficult for health officials to respond to the situation. For the most up-to-date information, please visit the GNWT's COVID-19 response website. I know this is a difficult and uncertain time, but it's important that we all remain calm and committed to following the public health orders and recommendations. We need to help support our community members who are now isolating, So if you know someone, please reach out and check on them. Northerners are known for their sense of community, so let's make sure we show that in the coming days and weeks. As I've said many times before, if you haven't been vaccinated yet, please book your appointment. We all need to do our part to protect our communities and our loved ones, and this is one of the best ways that each of us can contribute to that effort. And now, I'd like to turn it over to Minister Green. Once again, thank you, everyone. My mask.
Good morning, everyone. Thank you, Premier. I'd like to start this morning by recognizing that the past couple of weeks have been difficult ones for NWT residents, particularly for Yellowknifers. Just as we were preparing to relax some of our public health measures, we had an increase in cases, including the first confirmed cases of the UK variant. As a result, some Yellowknifers are concerned and anxious. That's understandable. If that's you, please hear me when I say anxiety in our current situation is natural. There is, however, no need to be scared. Our government and the Office of the Chief Public Health Officer are ready to react to this increase in cases. We are prepared and we know what we have to do to ensure that our friends, family, and communities remain safe. You're in good hands with my staff, and we will get through this together. The best thing to do right now is to stick to the public health measures we know work to stop COVID-19 transmission and to follow the guidance to bring the situation under control. Never has wearing a mask in public been so important, or to follow isolation protocols. The other thing within our control is to get vaccinated. We continue to see a lull in our vaccine uptake, and I want to take this opportunity to urge anyone who has not yet received the vaccine or anyone due for their second dose to contact their local health care provider and health center to find out how to access it. The GNWT is close to finalizing an exchange of vaccine with other provinces to acquire the Pfizer-BioNTech vaccine. The Pfizer-BioNTech vaccine is currently approved for those 16 years of age and older and is expected to expand to those aged 12 to 15 years old in the near future, allowing for greater vaccine coverage. Introducing a second product into the NWT's inventory will allow for a more flexible, sustainable, and reliable COVID-19 vaccine program. Once the exchange is finalized, the details will be formally announced and information will be posted to the NTHSSA social media and website. We need everybody who is eligible to get vaccinated so that we can get back to the things we love. Over the next few days, the situation in Yellowknife will continue to unfold in rapid and unpredictable ways. You will continue to have questions, and we are committed to ensuring you get the information you need as quickly as possible. I also want to emphasize that in spite of the cases announced over the weekend, there isn't necessarily a risk to you going about your daily business. Unless public health staff have reached out to you directly or have released a public health notice, a public exposure notice about a place you've been, there is no reason to jump to the conclusion you are at risk. Public health staff are doing the risk analysis work and are contacting people who may be affected as soon as possible, as well as providing information on what you should do to stay safe. I want to thank Yellowknifers for staying calm through this uncertain time and following the guidance of the Chief Public Health Officer. Dr. Kandola has had to make some tough decisions over the past few days. I support those decisions. A lot is being asked of all of us, but I am confident that together we will get through this and we will be stronger for it. Continue to keep gatherings small and spaces large, practice physical distancing, wear your mask, stay home, get tested if you are feeling sick, and get vaccinated to protect yourself and others against COVID-19. I would now like to invite Dr. Kandola to provide some detailed remarks about the public health advisories that have been released over the past 2 days. Thank you.
Good morning, everyone. NWT residents, you have done a remarkable job being resilient and helping fight COVID-19 in the past 13 months. So now, we've hit a challenging period in our pandemic response. Over the past 3 days, we have announced 8 confirmed COVID-19 infections at NJ McPherson School, and we have declared an outbreak at that school. Local public health staff are currently working on identifying all contacts to these cases, as well as the additional 12 probable cases. This outbreak comes at the heel of a Yellowknife cluster of 5 COVID-19 infections picked up by wastewater testing. That was announced on April 19, 2021. I am thankful that 4 of those 5 cases related to the Yellowknife cluster have now fully recovered. However, with respect to this new outbreak at NJ McPherson School, we need to take strong actions. Those actions include closing all schools in Yellowknife, Detta, and Ndilo to in-class learning until further notice. There have been many contacts and exposures involving multiple students who attend these Yellowknife-based schools. So students will shift to remote learning while schools are closed. All extracurricular club and sport activities for kids under the age of 18 are also suspended for the time being. I have also issued a public health order that wearing a non-medical mask in all indoor public spaces is now mandatory, except when you are eating or drinking. We are also recommending that non-essential travel in and out of Yellowknife be cancelled or deferred at this time. However, if you have necessary medical appointments in Yellowknife, we ask that you attend these. Do not cancel or defer them if possible. After-school care programs are suspended until further notice. All daycare and day homes are able to stay open unless impacted by school closures or those that have received public health direction to close. We consider them an essential service at this time, and the public will have to check with individual day homes to find out if they're open or not. As stated, we have not mandated a closure of day homes and daycares other than those impacted by the school closures and outbreak declaration. We are also strongly encouraging employees to work remotely if they can. I know these measures will impact many people in Yellowknife and in our territory. It impacts our children's education, parents' work schedules and childcare opportunities, social activities, employers running businesses, and many more. So these are not easy decisions. Nobody wants to close schools to in-class learning or suspend extracurricular activities for our children. But they are necessary right now. With a growing number of cases and contacts, we need to do all we can to stop transmission in the highest risk areas. It was imperative that we put into place strong measures quickly and notify the public of the growing list of public exposure risks. I also want to clarify direction for household members of student and staff at NJ McPherson School. As a result of the evolving situation, all students, staff, and volunteers attending during the week of April 26th to 30th are now considered close contacts. This means that all household members must isolate too. Essential workers that are fully vaccinated, that means 2 weeks after your second dose of the COVID-19 vaccine, may seek permission to go to work. You must review your circumstances with your employer and then apply to protect NWT for permission to go to work. If granted, you will be required to isolate outside of work. And this only applies while you don't have symptoms, and neither does anyone else in your household. This is a shift from the earlier guidance that all fully vaccinated household members can go to work. If there are essential workers that are not fully vaccinated or have specific circumstances, they should contact Protect NWT to have their situation reviewed. Children under the age of 18 are an unvaccinated portion of our population, and we must protect them. We are confident that these temporary measures will do that. And we are confident that they will be effective in protecting the rest of Yellowknife as well. This is also a good time to stress that fighting COVID-19 is a collective effort, and we need to be extra vigilant at this time in doing the things that we know work to stop the spread of this virus. So those things are keeping a physical distance of at least 6 feet or 2 meters, wearing masks when you're out, keeping your crowd small and spaces large, washing your hands frequently, staying home even if you're feeling a little sick, and then calling your healthcare provider or local health center to be assessed if you have any COVID-19 symptoms. Limited indoor household gatherings to no more than 5 regular visitors or your Fab 5, to a maximum of 10 people in the household at any given time. Keep your gatherings small and self-isolate responsibly whenever required. And let's not forget to get vaccinated. Vaccines will help us defeat COVID-19 and get back to doing the things that we love. The vaccine is here, it's safe, it's effective, and it is available. So make an appointment if you haven't already. If you have received your first dose, make sure you book an appointment for your second dose. You are not fully vaccinated until 2 weeks after you receive your second dose. As we continue to respond to this pandemic, I want to thank everyone who continues to come forward to get tested for COVID-19 and to provide information to public health staff when new cases are identified. By doing this, you are helping keep your family, friends, and communities safe. We can't fight or defeat COVID-19 without our residents doing these things. And I also want to thank our healthcare staff for working with our residents to help them navigate this difficult time. It's not an easy job, but in a pandemic, it's vitally important one. And I want you to know that your efforts are not going unnoticed. This isn't the first challenge our territory has faced during the pandemic, and it likely won't be our last. But we have overcome these challenges in the past, and we'll overcome this together. So let's continue to stick together. Let's continue to be kind to one another and help one another, especially on social media. Let's get vaccinated if you haven't already. And let's follow the public health measures, both the ones we just announced and the others that have been in place for some time. So by doing this, we'll get through this, and we can all together defeat COVID-19. Thank you for your time.
Thank you, Dr. Kandola. So, as I mentioned earlier, I know there are a lot of questions. Cabinet Communications has also been monitoring social media over the weekend, and questions that have come into our press secretary account. We'll do our best to try to answer as many of those as possible today. One question, one follow-up to each reporter. I think we'll probably be in a good situation to do that twice, but we'll reevaluate that at the end there. So we'll start Brett, CKLB. And we'll get you guys to come to the mics, please.
Hello, thank you all for taking questions today. There was word of a vaccine exchange with other provinces, so I'm wondering if we can get some more details on how many Pfizer vaccines we are seeking to obtain, which provinces we are exchanging with, and how many vaccines I assume we are giving in this exchange.
Hi there, thanks for that question. I'm able to give you a couple of details. Right now we're in the process of negotiating an exchange with British Columbia to obtain Pfizer vaccine in exchange for Moderna vaccine. The target population for that exchange will be initially teenagers aged 16 and 17, which is the current indication for the Pfizer vaccine. In terms of numbers of doses and the details of the exchange, that's still being finalized, but we are aiming to have vaccine to begin that segment of the population in the coming weeks.
Yes, so does this change any sort of targets towards herd immunity now that we're expanding towards 16 and 17-year-olds, or have those concepts been thrown away?
So when we can add another eligible population, it increases our total population coverage. Right now, there's not one exact percentage for herd immunity, but having the population 16, 17 immunized will definitely improve our risk around outbreak spreads. The other information that we're looking for that should be released shortly is expanding the population for the 12 to 15-year-olds. So in total, the 12 to 17-year-olds, we're looking at about 3,600 students in addition to the adults that we can immunize. Given that this is a social population, they're congregated in school situations, any ability to vaccinate this higher risk congregate population will actually improve our ability to control the spread of COVID-19. So we are looking forward to Health Canada announcement on this.
Thank you.
Minister Green, did you want to touch on that at all?
Sure. I'd like to commend the staff at the Department of Health who've worked really hard to make this additional vaccine available to us. And as I said in my opening remarks, the details are still being finalized, and when they are, there'll be more information available. Thank you.
Sarah, Cabin Radio.
So I'm wondering if the NJ cases are related to the initial cluster of the 5 cases in Yellowknife from a few weeks ago, and if not, do we know where they came from yet?
So an investigation is ongoing, so we can't talk specifically about those details, but we do know that NJ an outbreak has been declared in NJ, so that's initial ground zero of this outbreak. What we do know is that a number of the NJ students, staff, or other people participating in that week have had events that involve multiple other students in other schools. They've also have gone to stores, or they've gone to restaurants. So we're in the process of looking at that exposure notification. What we do know is that we were able to pick this cluster infection pretty quickly. We were able to shut down NJ, have all the households isolate, and we're picking up more and more infections in this group and reaching out to their contacts. At this point, no other school has met the definition of an outbreak. This outbreak in NJ is no way, shape, or form connected to what happened in St. Patrick. There's no connection. Why we had to shut down the school is given the number of exposed close contacts to the cases that we're finding in NJ, that they're currently likely incubating the virus, haven't become symptomatic. Some people would be, but we wanted to prevent those students or staff going into schools with a large amount of unvaccinated population and thus causing more outbreaks. So we had to almost do like a circuit breaker for the school situation.
And so I guess if we don't know yet if these clusters are related, then why are we not calling it community spread?
We are on the brink of community spread, but when we declared an outbreak at NJ, pretty much in all the grades there are cases, but to date, all the cases and probable cases have been connected to this specific outbreak in NJ. To date, we haven't had any other cases occurring that haven't traveled or have not been connected to close contacts or a COVID case. It's like this NJ McPherson outbreak is a cluster in and of itself, and we are currently undergoing investigations about any links to the YCAT cluster.
Blair, NNSL.
Yes. Is it true that some variants can stay in people's bodies for 17 days?
Okay.
There's quite a lot that we still don't know about the variants, actually. It's an evolving area of science. There are new variants that are becoming apparent as weeks go on. There is potentially some research into a longer period of transmissibility or a longer period of infectiousness for some of the variants, but at this point that's not been entirely determined, and we haven't made a change on our isolation requirements based on any of that at the moment, because that science is still being finalized.
Okay. If it's found out that some of these variants do stay in people's bodies for more than 14 days, like 17 days, would this necessitate revising the isolation protocols?
It may. I'm going to just start and then I'll let Dr. Kandola answer. I think she can elaborate on this too, but there's also a difference between transmissibility and detectability. So we do sometimes detect the virus after someone is no longer infectious because of the sensitivity of the test. So potentially as science evolves, there would be a reevaluation. I'll let Dr. Kandola speak to that. But I think that's a really important point to keep in mind, that just because a virus can be detected does not mean that that person is still infectious or capable of transmitting it.
Thank you, Blair. So the question that you're asking has been raised by the Technical Advisory Committee at the federal, provincial, territorial level, and their analysis has indicated that the current variants that we're dealing with do not need to be treated any differently, that they're still working with the 14-day incubation period. And as Dr. Peg has stated, people can shed the virus for weeks, and it can even be detected months after a known positive COVID infection, but it doesn't necessarily mean that they're infectious. So you can detect the virus for a long time after someone's been infected, but it doesn't mean that their period of infectiousness has completed and they're not a risk to the public. At this point, we are still continuing to keep the 14-day self-isolation period. What we do know is in Canada, the most predominant variant we're seeing is a UK variant. For this particular scenario with the NJ outbreak, the way it's spread, it's going to be a variant. That's what we're probably going to see in a week or two. We do know that the UK variant is covered in our current vaccine, and so we do recommend for those who can take the vaccine to get the second dose and get vaccinated.
We'll turn now to Leanie, CBC.
Thank you. My first question is probably for Dr. Kandola. So non-essential services were closed last April with fewer cases at the time. Are you considering closing non-essential services now? And if not, what is different?
So NWT is in a much different position currently than it was a year ago. With our community level coverage that we received 2 weeks ago, we do know that 68% of residents who live in Yellowknife who are eligible for the vaccine have got at least one dose, and 52% of our Yellowknife residents have received the second dose. So we are encouraging that 16% gap we're seeing between the first and second dose. We are encouraging those who were waiting to take the second dose to book online and get the second dose as quickly as possible. But this higher immunization coverage has different public health risk assessment than what we had a year ago. What we do know is that the vast majority of unimmunized individuals in NWT are school age, under the age of 18. So the partial lockdown would be addressed to those populations. We've closed the schools. People who are identified as close contacts, such as the N.J. McPherson School and other exposures, are asked to go under isolation. And as we continue to look at the scope of magnitude, there will be more and more people identified as close contacts. But those measures are adequate right now for a public health response. In addition, we have other measures of discouraging non-essential travel in and out of Yellowknife. We also have that mandatory masking, because if we're dealing with variants, we really want to limit public exposure to any scenarios where they could be exposed, especially if they're partially or immunized or unvaccinated. So we'll continue to monitor the situation, but at our enviable higher immunization coverage, it doesn't necessitate a complete lockdown of Yellowknife.
So you're calling this a partial lockdown?
It's not, it's a partial, just to say, we have asked everyone who is in NJ, which is the entire schools as close contacts, they're in self-isolation, so they're in a containment mode, and any exposures related to active cases, they're in containment. For the schools, we're closing the schools to prevent further spread.
Did that count as, okay, thanks. So you've been encouraging people to cancel non-essential travel in and out of Yellowknife, and I wonder if there are any check stops set up on Highway 3 to inform people about that.
So the recommendation of non-essential travel in and out of Yellowknife is a recommendation. It's not part of a mandatory order. But what I can tell you is we've seen a significant increase in travel coming into NWT period. And we do know that Alberta has one of the highest rates of active infection in Canada, and that they've averaged over 2,000 cases daily in the past couple of days. And so we are strongly urging people, if you have no reason to travel outside of NWT or anyone to travel into NWT at this point, just for the next several weeks, please change your plans or cancel your plans, because this is not a good time to travel in and out of NWT, and especially not a good time to travel in and out of Yellowknife.
I think that's a good segue into a question I'm seeing online for Premier Cochrane. A lot of people are talking about they're seeing license plates that are not local, and if the enforcement teams are out there doing their checks to ensure that everything's being followed. Can you speak a little bit to the enforcement situation?
Thank you. I do want to start with saying that I know that people are afraid, but like has been said today, we have been preparing for this for over 14 months. We're feeling that we're well prepared for it. Have faith in the public health system, abide by the orders is the best we can do. We are working closely with community governments and Indigenous governments. We meet with them on a regular basis. We will be sharing the information. I know that some communities are afraid as well, and so no community is allowed to do check stops, just letting you know that. I know Betchico, Fort Res, Lutz Cay, people are afraid. Providence, people right across are afraid. No one's allowed to do a check stop, only the RCMP. However, communities are looking at giving people information, and that is appropriate to help share the message, to actually help inform people. But I do want to say that the best defense we have right now is for people to follow the orders. Keep your social distancing, wash your hands, keep your bubbles small, and please, please get vaccinated. So we're not forcing the vaccination, that's a plea. that is a part that we're asking people to do your part and get vaccinated. However, if you do break the orders on that part, that is an order, that's the law. And at this point in the time, with raging in the South and now coming into the NWT, I've given that direction since Christmas, and I will be following through with it. That says everyone, we all know now, it's time for people to start abiding by the order, and if not, there will be consequences. Thank you.
Thank you, Premier. We'll turn now Bailey, True North FM.
Thank you for your time, everyone. I was wondering for the Pfizer vaccine swap if there'd been freezers acquired to store the vaccines.
Thanks for that. Yes, when the Pfizer vaccine was first approved, and while we were waiting for approval for other vaccine products, there was a lot of discussion regarding how the NWT could be prepared, and in the preparations for a vaccine rollout, we have been able to acquire appropriate freezers to store that vaccine, so that's been well planned for in advance.
I think this is for Dr. Kandola. There were 5 different exposure risks, or 5 different locations with exposure risks in Yellowknife, and 2 of them were you only had to self-monitor for symptoms. I was wondering if you could explain why that is.
So when we have a case, we go back and look at what the close contacts are during the infectious period, and we identify all those close contacts. So we can identify who spent 10 minutes face-to-face, and when we have that scenario, we don't need to do an exposure notification. But if it's a scenario where someone has gone into a large department store or a restaurant, what we have to assess is how much time that person spent, or if there was anyone that would have been close enough to them for a time that would put them into a higher risk category. When we look at grocery stores, or we look at some of these other scenarios, people are going and moving very briefly. They're not spending that much time with other individuals, but we still need to put the time period and exposure notification. So in that scenario, we're saying self-monitor, and if you have symptoms, contact your public health or your local health center. In the scenarios where there's been a small space and where people have been there for a long time and people have been within close enough range, and we would say self-isolate for 14 days. It's more what that case was particularly doing and the risk to the public, and so that's how we distinguish.
Dr. Pegg, can you build on that a little bit and try to explain to some of our viewers at home the contact of a contact piece? I think that's a confusing piece that we've certainly seen a lot of chatter about over the weekend.
Yeah, that's a confusing concept. So particularly in this particular situation, the term that you hear a number of different terms. One of them is close contact, and that is someone who has either been identified through a contact tracing investigation by public health as being in the same household or having spent a significant amount of time with a confirmed case. That's also been the case that's applied to the NJ McPherson school at this point because of the widespread nature of the cases and how they've been distributed throughout the school, that those individuals associated with that school have been also named as close contacts. Contacts of contacts are the second circle. So someone who's named as a contact has been in close proximity to a case. Someone who's a contact of a contact has been in close proximity to that contact. It's a second circle away from the actual case. And what we're doing right now is trying to focus very much on identifying the contacts, particularly the very close ones who have had a lot of interaction potentially with the case, and prioritarily test those people. People who are contacts of contacts may be self-isolating depending on the nature of their exposure, whether they be in a household or other type of contact. Those people don't necessarily need to get tested unless they've been approached specifically by public health telling them that they should get a test, or if they become symptomatic. We are aware of a huge increase in demand for testing right now, and that's a great sign because it shows that people are interested in doing their part to get tested. But with the capacity that we have, we really need to do our very best to do the tests on the people who are most likely to be affected first. And that's the reason for that testing strategy that we've put in place right now. We are looking to increase capacity in our testing center and to increase the availability for testing appointments, but hopefully that clears up a little bit why some people are being approached for testing and why some other people may in fact be turned away at the testing center, because we are really trying to focus our energy right now on the highest yield contacts and to identify the chains of transmission for this outbreak.
Okay, thank you, Dr. Pegg. We'll turn now to Thomas Mediateno.
Good morning. Maybe I think my question is for Dr. Kandola. You can all help us summarize information about immunization. Some people, I guess parents and staff from NJ school, as well as people targeted by notification of risk exposure, might say, well, I have my 2 doses of Moderna. Is there different guidelines for people who are fully immunized?
So in households where people are close contacts, most of those close contact in this case will be unvaccinated students. Because they're close contacts, and given how fast this is spreading, we're asking those households to isolate. If they're essential workers and they're fully immunized, we are doing an exemption process, but we're doing tests as well. We do know that the vaccines are not 100%, that they're 90% effective, and that people who are fully immunized may pick up the infection. They may not get sick, may not be required to be hospitalized, but they can pick up the infection and they may transmit it. Given the closeness of these situations in a household, there are many, many opportunities for fully immunized people to be exposed. And so just to limit further spread with close contacts, we're asking that fully immunized people also isolate as a household, with the exception of if they're essential, they're asked to contact Protect MT, contact the employer, and then we do a risk benefit, and we would have to monitor them and test them. But we're in a situation where we have a rapidly spreading outbreak right now, and we can't afford to have additional exposures.
I think Minister Green could answer to my next question. We saw parents at NJ School saying it will be difficult to afford to lose 2 weeks of salary. Could you maybe summarize information you have, or is there any help available from the GNWT or any efforts to inform the parents of the help they can have?
Thank you for that question. I've had this question a couple of times over the weekend, and it really is a question that belongs to my colleague R.J. Simpson as the Minister of Education, Culture and Employment. But what I've been telling people is to look at the federal suite of health benefits for people who need sick leave, who are not getting sick leave as part of their job. They can apply for those benefits. The application is straightforward. They need to be working right up until the time they were laid off because of the pandemic. They're eligible for up to $2,000 a month month. The payment comes 2 weeks after the application. This is called the Canada Emergency Recovery Benefit. So at this time, we're directing people to that program, and we don't have an NWT program. And income assistance would not be available to people who have been laid off and just now, and just as a result of this isolation. So that's why we're directing people towards the federal benefit. Thank you.
Okay, we have time for one more question for each reporter, so I'll just make my way back around. Sarah, did you have another one from Cabin?
So just in regards to the travel in and out of Yellowknife kind of not being recommended right now, I know campsite reservations open tomorrow. A lot of people are going to be thinking about getting out of town for weekends coming up and going to other regions, but not necessarily to other communities. Is that not being recommended at this time? And I guess an extension of that, if people want to go to, say, like Cameron Falls or go hiking on the weekend, is that also considered leaving the community?
So when I'm thinking about recommendation of essential travel in and out of Yellowknife, I'm specifically looking at communities. There are some communities that have really low vaccine uptakes, and last thing we want is for people to come in and have an exposure and then go back and bring it into their community. So if you're coming into, if you're wanting to go outside and go to Cameron Falls, there is no real community that you would put at risk, other than the only risk would be waking up bears right now. But you have to use that risk assessment. Like, are you coming in from a small community, spending time here, spending time with high-risk population, like visiting your cousins and families, and then going back into a small community? That's what I'm trying to avoid, is just defer that. Come for medical reasons. This is of huge concern. People have medical appointments. This is, when we haven't declared community transmission. We have an outbreak. We're isolating all cases and contacts for the outbreak. We closed schools, not because those schools had outbreaks. We're closing schools so that all those students and staff who were exposed don't cause further outbreaks in the school. But we really are encouraging people to come in and get their medical appointments done. And for the people who are not required to isolate, who want to go outside and go for a walk, we're not isolating all of Yellowknife. We're specifically isolating people who are close contacts.
Bailey, True North FM.
I know the Premier touched on enforcement a bit, but I was wondering what enforcement for the new mask rules for mandatory mask indoors is going to look like.
So before masks were a recommendation, and I do have to give credit to a lot of people in the NWT who I've seen throughout the months wearing masks, but now masks are mandatory. Anyone indoors will have to wear the mask. Again, we don't have enough task force officers to have one officer on every person. We are counting on the general public. I'm sure that a lot of stores will be turning people away. Offices will be turning people away if they show up without masks. But report. Nobody likes to be the person to report. However, we're in a pandemic. So if you do see people that are not abiding by the orders, phone 811. Call Protect NWT, and we will follow up and make sure every one of us has a role in this. We do the best we can, but we can't do it alone. Thank you.
Blair?
Is it known how many of the cases related to the NJ outbreak are children?
We don't go into specific details, but the vast majority are children.
Is it known the age range of those children?
it's a good question. So when we first started on Saturday, we were dealing with one individual in one class, and we were reaching out, testing that particular class. And while we were doing that, we were made aware that there were more and more symptomatic cases. And when we started to go out and reach out to all those cases, it involved all the grade levels, and these cases were testing positive, of which we've had 8 PCR confirmed cases, but we're looking at 12 probable cases, and of that, 9 of them are already ID now confirmed positive, and pretty much the vast majority of those are linked to NJ.
Brett C. Kelby.
So given that it is breakup season and there's potential of flooding, I know that some communities like Fort Simpson, if there is flooding, they will be evacuated to Yellowknife. Given the current cases, will they still be evacuated to Yellowknife, or will they be quarantined here, perhaps?
Thank you. Municipal and Community Affairs works with every community government to make sure that they have emergency responses for things like flooding, forest fires, etc. So you're absolutely right that normal practice, a lot of the communities, especially in the surrounding areas, their evacuation plan was to come to Yellowknife. Based on what's happening in Yellowknife right at this moment, we do have staff working with those community governments to make alternative arrangements for evacuation just at the current time. So Yellowknife will still be a major evacuation center, but if things do not get addressed within the next couple of weeks, we're looking at alternatives. Thank you.
Dr. Kandola, a scenario question for you that we had a couple people ask us over the weekend. The question is, I am supposed to go back to one of the mine sites this week, but my child is at home self-isolating because they attend NJ. I have both of my shots. What do I do?
So those mine sites they need to talk to their employer. At this point, given the number of cases we have in NJ, everybody in NJ is considered close contact. If people are going in high-risk congregate settings where they introduce spread, it can impact many people. Those situations have to be discussed very carefully, and we're working with the mines on this very question. But our current approach is we wouldn't recommend anyone who's a close contact of a case during an active outbreak to go into a high-risk congregate setting, even if they are fully immunized.
Thank you, Dr. Kandola. Leni, CBC.
Thank you. We've heard from the French school board that they knew about the school closures at around 8:30 last night. How soon did public health know, and can you kind of talk to me about the decision to wait, to let other people know?
So I've been working with ECE throughout the weekend, and around that time, I had given permission to ECE to inform the school boards and the principals. And so they were aware, and the decision to inform the parents and the staff came at a later period once we released the public health advisory. During that time period, we were made aware of more and more probable cases, and we at that point had changed our definition of close contacts to specific classrooms to involve the whole school. And so that's the ongoing nature of assessing the magnitude and scope of the outbreak and making those critical decisions.
Thank you. A question I saw, I believe, on the CBC live stream that would probably be beneficial to answer today. Dr. Kandola, do the announcements and public health advisories that went out over the weekend concerning specifically school closures and masks, do those change the other orders recently announced, such as remote tourism and 8-day isolation, or your timeline for emerging wisely?
So with the remote tourism applications, those applications are meant for the openings in the summer, and we're undertaking review of those applications at this point. And so those timelines do not change because I anticipate that this outbreak is not going to last that long. We're just testing, isolating cases and contact tracing at this point, and the faster we do it, the better we can bring this under control. This is not going to go on for weeks. So we will continue as planned with the summer opening of most of these remote tourism activities. The fully vaccinated, what people have to realize that if you're fully vaccinated, and you're coming into the territory, you want to do that day 8 test, you cannot be in contact of a person with COVID, and you can't be part of an outbreak cluster. So the same restrictions that apply for people seeking that second week of self-monitoring is the same restrictions that we're applying right now. If you are coming in after travel and you're fully vaccinated and you want to do a day 8 test, the only way you qualify for that second week is you cannot be named as a close contact of a COVID case, or you can't be part of an outbreak cluster.
And final question, Thomas?
Dr. Kandola, just for the clarification, why close all schools today and not last week when it happened at St. Patrick High School?
This is a completely different scenario. When we, 2 weeks ago, when we made aware of an exposure at St. Pat's, this was an exposure. It was narrowed down to a certain time period, and we were able to determine that there were 40 close contacts. So we were able to put those 40 close contacts into isolation, test them regularly. They would have completed their full self-isolation period today. There was no positive cases resulting from that exposure. That's an exposure. What makes this different right now is it's not exposure, it's an outbreak. An outbreak is that students, staff, or volunteers who attended NJ McPherson in the last week attended while they had active COVID, were infectious, and we have picked up transmission not just of one more, which would have, we only needed 2 to be declared an outbreak, but at this current time we have 8 confirmed cases from NJ, and we have an additional 13 probable cases resulting from this scenario. So it is an outbreak that had occurred in a school, and there's transmission. It's very different from an exposure where you have COVID and you expose people, but we had no transmission from that exposure. So one's an outbreak and one's an exposure.
All right, thank you, everybody. We're going to end it there for today. Thank you to those media for your thoughtful questions, residents at home for asking questions. Please continue to check the COVID GNWT website. COVID Secretariat has a frequently asked questions guide there. They will continue to update on a regular basis to try to answer all of these. Keep going back. Sometimes the answers change a little bit, so just check those. Again, if you have any questions for Minister Simpson, please do not hesitate to contact me after or email our press secretary account for reporters. As always, everybody just take care. Thank you, Premier Cochrane, Minister Green, Dr. Pegg, and Dr. Kandola. Have a good afternoon, everyone.